My name is Martha Elaine Grady, and in 2011, I had a heart attack. I started having pains go up my arm, and I thought, okay. I go to the doctor, and he says, well, I think it's your carpal tunnel. And I'm like, I'm not sure. So eventually I go to the cardiologist, and he says, I don't think it's your heart. And he did the EKG, the EEG, and I said, I want a heart catheterization done. He sets it up. I go in and have a heart catheterization in 2011. I didn't make it out of the hospital that day. I had 5 blockages. 4 of them were 85 to 95% blocked. So she puts in 4 stents, and after 12 hours, I go home and I'm fine until 2021. And I start having the pain again. And my husband said, okay, we're going somewhere else. So we came here to Riverside.
Cardiovascular disease is the #1 killer of women, killing 1 in 3 women. So take a look around at your loved ones who are female and say 1 in 3 women will die from heart disease.
The heart muscle has tremendous energy requirements as it's squeezing the blood through the body, 80 times a minute for your entire life. And the energy that it requires is in the form of oxygen, which is delivered through the bloodstream. Coronary artery disease is a disease of the wall of the artery where people get a progressive plaquing in the wall of the artery. And then a cascade of events occurs where platelets, or the blood clotting cells, start to stick on that plaque. And if it does so to a certain extent, it compromises blood flow down the artery. And in many cases, it completely occludes the artery. And then people present, with symptoms of heart attack, which can vary from person to person, but they develop oftentimes, a diffuse heaviness in the chest, pressure tightness. It might be very similar to what they've had with exertion, but in terms of quality and location, but it's often more intense, and they can tell that there's a sudden change. All health systems are geared to try to treat those people in as timely a fashion as possible, because it's been shown the sooner the person gets here and the sooner it's recognized and then the person is treated, the more likely it is they're going to survive it. And just as importantly as surviving it is having a heart muscle that still has normal capabilities of strength. Inpatient mortality rates from heart attack have improved dramatically. If you look back decades, 60s, 70s, rough numbers, the mortality rate if you made it to the hospital with a heart attack, 30%. And now the survival rate is about 95% if you make it to the hospital.
I'm on blood pressure medicine. I went to cardiac rehab, which I recommend. And eventually I hope to do the 3rd phase of the rehab, which is working like in a gym and learning how to use those machines.
So how do we prevent heart disease or even treat heart disease already present? Knowing your numbers, knowing your risk factors, both the traditional and gender-specific risk factors to women, that seeing your primary care providers regularly and a cardiologist as necessary, and treating any of those risk factors or disease processes to ensure that we really are preventing and mitigating risk. And it's very important to understand the risk of cardiovascular disease, that it is very prevalent in women, but that there's also things we can do about it.
You feel that pain going from up your arm, across your chest, into your neck, in your back. Don't ignore it. Get help. Don't ignore the pain. Don't ignore the symptoms. Don't say, oh, this is nothing. This is not anxiety. This is not angina. I was told that. And my doctor here told me, don't ever let anybody tell you that it's just angina, because it could be something more serious. Have it checked out. If you don't want to go to the ER, go to your doctor. Call your doctor. Talk to them. Take that pain serious. It is serious. It could mean whether or not you make it to the hospital or not.